are finished, probably early next week. So again, if you have any questions, please type them into your question box. For those of you wanting to earn CPEUs or CERPs as registered dietitians or lactation professionals, just remember that you must register and pay in advance and attend either on using the email and computer where you registered, or if you're attending in a group or on another computer, you need to email me, please, maumann@calwic.org, describing the situation, how you attended the webinar differently, and then we can process your continuing education request. You'll need to attend the entire webinar and complete an evaluation, which there will be a link to in your follow-up email tomorrow. And then it'll take us a few weeks to process your certificate, but we hope that it's a worthwhile experience for you. All right. I don't see any questions yet. That's good. So I'd like to introduce our first two speakers, Laurel Hiroshige and Leslie Munoz. Laurel is the Regional Breastfeeding Liaison at North County Health Services WIC. It's in the San Diego area. She completed her bachelor's in nutrition at Cal Poly Pomona and did a dietetic internship in Connecticut and has been an RD for 28 years. She's worked at Riverside County WIC, several hospitals, and has been at North County Health Services for the past 15 years. She counsels both pediatric and adult patients in nutrition and promotes breastfeeding in her community. She's one of the original California Regional Breastfeeding Liaisons, fondly called RBLs, and her WIC agency is known for sharing their successful model where newborns are seen by an IBCLC at their first provider visit. Leslie is Laurel's partner in crime, as we might say. She graduated from California State University Fullerton in ethnic studies, focused a lot on playing soccer in college and for the Mexican national team. But she grew up in a family where breastfeeding was the norm, and she breastfed both her own sons, and she never knew at that point that her passion for breastfeeding would later become a career. But she's now an International Board Certified Lactation Consultant, or IBCLC, and the site manager at Neighborhood Healthcare in San Diego area. She's the lactation co-champion at Neighborhood Healthcare Prenatal, and they've won awards for being breastfeeding-friendly workplace, and she's presented on past webinars and at our annual conference. Her goal is to expand the lactation program at Neighborhood Healthcare, and offering more trainings to staff, providing all patients with postpartum breastfeeding support, improving breastfeeding rates within their community, and they want to be one of the very first community health centers to be recognized as breastfeeding friendly. And as you'll see on this webinar, they are well on their way to doing so. So Leslie and Laurel are going to tell us about their partnership and what they have done to implement breastfeeding-friendly practices. We'll switch over to your slides, and Leslie and Laurel, can you make sure your mics are on? And here we go.
Okay, thank you, Margaret. This is Laurel. Good afternoon, everyone. This is a 9-step presentation, and our part is highlighting one clinic's journey through the process, which is neighborhood healthcare, as you mentioned. Before we dive into each step, I'd like to give you a little bit of a background just to help you understand where this began. First of all, neighborhood healthcare is located in Escondido, California. I'm waiting for the next slide to come up here. Okay, thank you. And it's located about 5 miles away from my clinic, North County Health Services. We're both in San Diego County, in North San Diego County, and both of our clinics have the Comprehensive Perinatal Services Program, and we're both federally qualified health centers. And that will come into play later for billing purposes. A few years back, through a WIC RBL, or Regional Breastfeeding Liaison Grant, we were asked to share our successful model for breastfeeding support to neighborhood healthcare. And so what I did was I came over as sort of a technical assistant, and I hung out at neighborhood healthcare a couple times a week at the beginning. But one of the key points was we supplied 2 IBCLCs, or lactation consultants, to work at neighborhood healthcare over a year's time to provide the clinical services. And we also had a company track some data for us as far as breastfeeding rates, and we also tracked some financial data that you will see later. But a stipulation of the grant was to identify a person to take over the clinical services part of the grant once that grant ended. Because as you guys know, sometimes when you have a grant and the plug is pulled out, it kind of just ends. And we wanted to make sure it didn't happen here at neighborhood healthcare. And so we designated a person, and I think it was the best person in the world, and that would be Leslie. And so she's going to tell you her story way back when and bring you up to date.
Hi, everybody. This is Leslie. So as Laurel mentioned, as part of the breastfeeding grant, I was identified to be the lactation support at neighborhood healthcare. I first became a lactation educator, which is a training that is about 40-hour classroom, or you could do this online training that involves shadowing a lactation consultant, completing homework, and I later on became an IBCLC, so International Board Certified Lactation Consultant. I passed the lactation consultant test and became certified in 2013. This test is only given, I believe, annually or twice a year now. And I am now working as, and I've worked as a prenatal coordinator throughout neighborhood healthcare at all 5 of our locations. And I am now serving as the site manager at our largest prenatal site within the organization, where we do provide the lactation support during the newborn visit.
Okay, and here's a brief overview of the 9 steps. Later, you're going to see the same slide, and it's color-coded, showing neighborhood healthcare's process or what they still need to work on. But we're going to be talking about each step individually during this presentation. Here's a few of the reasons, benefits for doing the 9 steps.
So I'll be talking a little bit about the policy and protocols. Neighborhood healthcare has been working diligently to implement some of these policies. One in particular that we're working on updating and revamping so that it's more specific to our neighborhood healthcare workflow and practices that can promote breastfeeding, and that is the infant feeding policy. This policy has not yet been approved, but neighborhood healthcare providers and support staff, which would be myself, have worked on revamping it, as I mentioned, so that neighborhood healthcare can promote human milk as the norm. We have a few other policies that we have worked on somewhat as well that we'll talk about in a later slide.
Step 2 is staff education and evaluation. And what we did a while back was do a training for the providers at one of their regular staff meetings. And also staff received a couple of 45-minute trainings, and that was also given at one of their staff meetings. And this is something that has to be revisited because of staff turnover. So earlier this year, our WIC agency was involved through the RBL grant again, sending one of our IBCLCs, which is Joanne in the picture, to do a refresher course for the staff. And that's important because You really have to get everybody on board with this project, all the way from the front desk to the back office, and they have to have buy-in. They have to understand why they're doing this.
So step 3, patient education. For neighborhood healthcare, patient education is a key part of our daily workflow. As Laurel mentioned earlier, we are a CPSP program here at Neighborhood Healthcare, which allows us ample opportunity to educate our patients. Here's where we do collaborate a lot with WIC, in which we do utilize a lot of the WIC breastfeeding brochures, booklets, and handouts that we could educate or use to educate our patients with. We do have a large prenatal site here with 5 CPHWs, which are comprehensive perinatal health workers, whom educate our patients. And we do this throughout the patient's pregnancy. We also offer education in the postpartum period, and we offer a series of 8 classes prenatally, in which one focuses just on lactation. We also are working on, and we're very excited to do this, but we're working on a series of 4 classes that are going to be specific to lactation and breastfeeding, and hopefully that can be completed by 2018.
Step 4 is clinical services. And like I mentioned earlier, we were involved in getting 2 lactation consultants seeing patients at Neighborhood Healthcare a few years back. And how they did this was they were seeing the babies when they came in to see their provider at their first newborn visit. And we called it something interesting. We called it an infant feeding assessment. So we didn't say, oh, you know what, the lactation consultant's going to show you how to breastfeed, because we found out that did not work. We had a script that I wrote up for the front office people so that they could say, oh, the provider would like you to see, you know, we call them by name, for an infant feeding assessment. After that, you're going to see the provider. Plan on being at the clinic for about an hour and a half. And that way they knew what to expect, and we could see all the babies. So we did it whether they were breastfed or bottle fed. And if that mom was a patient of Neighborhood Healthcare, then we were able to bill for that patient. But we saw all patients regardless.
So since the grant ended and the 2 IBCLCs that had been designated to work at Neighborhood Healthcare, I ended up taking over and was the CLE for a time, and then IBCLC, who provided the clinical services to all of our mother-baby dyads. So at the newborn appointment, I would, like Laurel mentioned, do a feeding assessment on all new mothers that were coming in with their baby. Since then, I've been promoted to work more in the administrative part of the clinic, and we have 2 lactation educators on site, and we're hoping to continue to get more of our CPHWs trained in the near future. But currently, our CLEs are available both in the morning and in the afternoon, and our schedules do match what our pediatrician schedules look like, so that there are no issues with access. And we want to continue to make sure that access is available for these mothers when they do come in for the support. I still, although I am working in management, I still see patients at least once a week when my lactation educators are out to lunch, or if they are on PTO or busy seeing other patients. I have had the opportunity to continue to do and provide the patients with the lactation support for that feeding assessment. One story recently that I saw a patient, she was a first-time mom. Both my lactation educators were unavailable, and our pediatricians call me and ask if I could see this mom who was very interested in lactation services. And it was, my schedule is pretty flexible, so I jumped right in and see this mom. The infant was 4 days old, and the mother, poor thing, ended up having mastitis. So between my nurse midwife and myself, our midwife was able to provide the patient with prescription for antibiotics. I was able to give the mother tips on how to alleviate the milk that was stuck in there, as well as how to nurse adequately, making sure that the latch was as it should be. And we're so happy here at my site that between the three of us, we are able to see any mother that walks in and wants a feeding assessment, or if it's recommended by our pediatrician.
Thanks, Tori.
So for step 5, the clinic environment, we are still working on, again, making this maybe a more specific policy within neighborhood healthcare, so that all of our clinics have an area, or all of our site looks very welcoming to those mothers who are breastfeeding. So what we do have, as mentioned, we have an award, or received an award for being runner-up of back in 2013 for being a breastfeeding-friendly clinic. What that means is that we promote breastfeeding. We have signs within our clinic that state breastfeeding welcome here. Our offices that provide lactation support have pictures of nursing mothers. We have rocking chairs in our lactation rooms. And overall, we promote a welcoming environment that promotes breastfeeding. At any time, if a mother wishes to breastfeed and wants a more private area, we ensure that we provide the patient with a private space so that they can nurse. We also have chairs in our waiting room that have arms so that the mother can nurse comfortably. And we avoid having anything that consists of posters, or formula in posters, magazines, or anything that really promotes formula in our more common areas.
Okay, step 6 is collaborating with local agencies and health professionals. And it's not all about WIC, although sometimes I like to think so. But at Neighborhood Healthcare, there's staff that attend the nurse-family partnership meetings and other community meetings. And Leslie has worked with some of the local hospitals in the area and the IBCLCs there. And as far as my part, being a WIC gal, what I do for Neighborhood Healthcare is I make sure that they have all the current outreach flyers, with the new income guidelines whenever those become available or they start running out. And like I mentioned before, our WIC agency provided breastfeeding education to Neighborhood. And another fun thing is that Leslie and I share some stories, because we share the patients between their clinic and WIC, and sometimes we hear good and bad things. And recently I just passed on a great story about a provider that was doing the right thing with breastfeeding instead of just starting formula right away. So I wanted to encourage that clinic, so that was good. And I got to say, after 7 years, we're just good friends.
Step 7, workplace lactation accommodation. So Neighborhood Healthcare promotes this, and we do have a policy on this, and it is included in our employee handbook, which is given to all new hires. The policy does promote lactation accommodation for all employees of Neighborhood Healthcare. Supervisors are made aware of this policy upon hire and training, so that if they do have an employee who wishes to take a break and pump, we can support that. It is always extremely helpful when an employee has a supportive supervisor. About 4 years ago, I returned to work after being on leave of absence, on my maternity leave, and I was nursing my baby at the time. And I did find it extremely beneficial that my supervisor was supportive. She had at the time been very involved in our lactation program that we had implemented. And she was very open to allowing me adequate time for nursing. And if I ever needed additional time to nurse or have a break, she was very, very supportive in that. I've seen my peers also have experienced the same thing that I did. And I also try to do my best to make sure that my employees now have adequate time throughout the day to take their breaks, to pump, to have a comfortable room so that they don't feel that they have to go to their car or use the restroom. And so it's really nice that neighborhood healthcare highly supports this.
Step 8 is financial sustainability. And this is a snapshot of some financials that were tracked at Neighborhood Healthcare over a 1-year period. And all the patients were seen regardless of their insurance, if we could bill them, if we couldn't bill them. So we just saw everybody, 100% of the people. And these were billed through the CPSP program if they were patients of Neighborhood Healthcare during their pregnancy. And because Neighborhood Healthcare is a federally qualified health center, the reimbursement rate is higher in that case. So when the newborns came in for their first visit, the provider billed for the baby and the lactation consultant, or CLE, bills for the mom. And so that's how the billing worked for us. And you can see that it brought in a boatload of money because it's almost $100,000 revenue in 1 year's time. And during this year, we found out that about 80% of the patients had straight Medi-Cal, and that brought in the most money. That was the big ticket item. And then if you look at the difference between the green and the purple box, we subtracted the lactation consultant's salary. And so that would be your net profit, $61,000. So not bad for a day's work, right?
Step 9, quality improvement and impact evaluation. So this is one that Neighborhood Healthcare is still working on, and we are not quite yet capturing as much data as we would like. However, a few years ago, back in 2013, Neighborhood Healthcare was part of a grant, and during this time, we ended up making changes to our templates in our electronic health records so that we can track a lot of the data regarding our lactation services. So some of the fields that were just changed so that they could be considered structured data in which reports can be pulled from. And in here, we are able to, or we're reporting the length of breastfeeding, the exclusivity of breastfeeding, whether they're combo feeding, and the template changes were done to our lactation or feeding assessment templates that we utilize, as well as every physical that is done with our pediatrician. So we have different opportunities to capture this data.
Now, this information was collected on breastfeeding rates before the grant was started, and then also, again, during the time the lactation consultants were seeing all the patients. And the way we got this information is that we called the moms somewhere between 4 and 6 weeks postpartum, and SurveyMonkey was used. And so we were asking the moms various questions in addition to how you're feeding your baby. How did you plan to feed your baby? What happened? What kind of help did you receive? Was your pediatrician helpful? What about WIC, education, barriers to breastfeeding? So we did show that the exclusive breastfeeding rates did go up after the intervention was in place.
So I want to talk about some other puzzle parts to the 9 steps and implementing them. One of the things that I do want to mention is that I feel that it's highly imperative that from all levels we have support, but especially manager support. As mentioned in step 2, WIC did come out, or Joanne did come out to do a presentation for our staff so that they understood why it was important to offer the patients the lactation services. And I think just as important as it is for the staff at the front office, the back office, to understand the importance, I think it's important that the manager is also on the same page and agrees with the services and really wants to promote the services. I've had supportive managers in the past, and I myself try to be very supportive, because we realize, I think, as managers, when you are involved with lactation or have that background or passion, the importance of the visits and how it's going to benefit the patients and our community overall.
Good point. Okay, and then the second one, which is green, staff input. We learned this one the hard way, because there were 3 clinics that we just sort of descended upon and said, okay, you're doing this. And we did not ask any of the medical assistants, medical receptionists, any of those people. Now, of course, the manager was on board, but it kind of caught the staff by surprise. So I feel it's really important to pull together some key leadership people, maybe some head MAs, to really get their input and figure out what's going to work with clinic flow and what ideas they have. And the purple section right there, the provider champion, we had the best MD champion here at Neighborhood Healthcare, and her name was Dr. Wade. She's not here any longer, but she was so pro breastfeeding. She would be pumping during some of our meetings, and she was just a great person. She was given admin time in her schedule to be able to meet with me on a weekly basis at the beginning, and then it was every other week. And what her role was is that she was kind of the mouthpiece for the providers. So whatever we were talking about or we were trying to implement, she would take it to the provider meeting and talk to them about it. So it was peer to peer. And we found that was the best way to communicate with the providers. And then as far as the kind of the turquoise section, scheduling and clinic flow, we did have to alter some of the appointment slots. That's okay, no worries. And at first, what happened was the newborn schedule had newborns coming in as early as 8 or as late as 4 p.m. So we tried to get that more to the middle of the day, because we were trying to provide a kind of a 6-hour window so that we'd have coverage by the LC. So we would not need to have them all day long or an 8-hour day. And plus, we had newborns coming in simultaneously for many providers. We had to look at that and alter it so that they were staggered, so that the lactation consultant wasn't inundated by, say, 3 newborns right at the same time. Okay, and the next one is just having regular meetings. I think that's important for communication. Clinic manager, I've also was meeting with the COO as well as with the provider. So that was critical. And then last but not least, the dark blue incentives and recognition. I've worked in so many clinics that MAs really have the power to make a program run or not run. And a lot of times people think, oh, well, why don't they just do it? It's their job. They really do need some incentives. And one example of a story that I like to tell is people were not making appointments, the MAs, with the lactation consultant. So I decided to have a little contest. And I was able to get movie tickets just donated from our own organization because it was within one of our clinics. And so I just put up some flyers and I talked about it at the staff meeting, and I said, oh, whoever makes the most appointments for the lactation consultant within a month period is going to get a movie ticket. And oh, I don't know, you would think $1 million was at stake. they started making appointments. They started realizing, oh yeah, let's get these patients over to see the lactation consultant. And then also at meetings, we awarded these tickets and they were just thrilled to death. And we continued to recognize them by doing a good job at the meeting to make sure that this was happening. Okay, last but not least, we're going to show you neighborhood healthcare. And the green means that they've already done these steps, and the blue means that they are still working on them.
So as mentioned earlier, we are still working on implementing some of these policies specific to the infant feeding policies, so that any one of our prenatal sites that offers newborn appointments and has a lactation educator, we can promote and follow the policy with infant feeding, making it be, human milk being the norm. And this is something that now that I've moved more into a leadership role, I would love to get going, and hopefully within the next year or so, and have higher leadership approve the policy and then roll it out at all of our locations. For quality improvement and impact evaluation, step 9, we, again, as I mentioned, we do have fields in our EHR system in which we can pull the numbers, but at the moment we're not really doing anything with it. And as I mentioned, now that I've been able to transition into more of the leadership role, I hope to work a little bit more closely with the data and tracking our rates, making a more smooth process of our referrals to our lactation services, and then also being able to track those that were referred and didn't show up, reasons behind it, so that if there's anything that we could do to improve our services here at the site, we can.
Okay, so that's it for us. Thank you.
Thank you.
Great. Thank you so much, Leslie and Laurel. This is Margaret again, and I'll introduce Jean Kettles. We have a little bit of background noise because there's landscaping going on outside our office, so we apologize if there's any interference in the future. Jean Kettles is the WIC RBL, or Regional Breastfeeding Liaison for Alameda County in Northern California in the San Francisco area. She facilitates partnerships between 7 local WIC agencies, hospitals, community health care centers, public health programs, and other community partners to improve access to WIC and quality breastfeeding care for WIC-eligible families. Jean served most of her professional career as a midwife, and she's been a CLE for over 28 years and an IBCLC just since 2016. She holds a master's in integrative health and applies her experience and integrative team building skills to the development of culturally responsive programs in which mothers and care providers feel empowered to thrive. She is a mother to 2 terrific teens who she breastfed years ago when she was also a WIC participant. So it comes full circle. We're so glad to have you with us, Jean, and I'm going to have you share your slides now. And we'll have questions after Jean's had a chance to present.
Hi, thank you, Margaret. And thank you, Margaret and Karen, and all the team at California WIC Association for continuing to create these forums where folks from all over the state can share what's going on, resource development, and Leslie and Laurel, I just love that, we started really with the individual story of a clinic over time, and you heard them, really keep it real about, well, we started this way and then we realized this, and how it takes some growth. So what I hope to be able to contribute to our joint conversation is a little bit of just some thinking around where might you begin as a clinic or as a partner agency to a clinic, and what resources are available to help, and share a little bit about what we're doing in Alameda County, a little bit about the county. This is not advancing. There we go. There Here's Alameda County, little heart of California in the center there. Very diverse, very populous area, a little over 1.58 million population total. Last year we had 19,500 births, and 45% of those were first-time moms. So obviously there's a lot of need for great education and support. 49% of those of all those moms were foreign-born, and 27% were Medi-Cal births. From some of the quality improvement looking that we've done, we all share this public health mission in the different health centers that work together. But still, with all the work that we're doing, we find that more than 77% of those mothers have less than adequate prenatal care. So we've got many families, many different cultures. We've got over 100 different languages and multiple systems of care with which we're working. We have a system of community health care centers that serve over 250,000 of Alameda County residents who receive their primary medical, behavioral, dental health care, and all the support services through these 8. They're all federally qualified health centers, and they operate independently and nonprofit. They together, though, they participate in quality improvement measures through a consortium. Like I said, we're all inundated with change, and yet we have these initiatives that help us pull together. 7 agencies, including the Alameda County system and City of Berkeley Public Health, run WIC programs, the Women, Infants, and Children programs that you've heard so much about. And there's 16 different locations of WIC. They all provide quality breastfeeding education with certified lactation educators, and many also offer multicultural breastfeeding peer counselor programs. And they collaborate through the Regional Breastfeeding Liaison Program, which I've been blessed to be able to support their efforts since the beginning in 2010. So how do we all work together to improve care for all? As mentioned, we've got a greater awareness of what the evidence is showing us. This is a very broad public health initiative, global, of course, with the World Health Organization, but also within our own national initiatives to really incorporate breastfeeding support and infant feeding education and advice for all mothers, regardless of their background, and that they should have access to care. The evidence points that it makes a difference in outcomes. But how do we start to improve that care? It has to obviously start with the relationships, whether it's a program to program, the individuals, like even as Laurel mentioned, how do the front office staff work with the back office staff, get the big picture. So relationships and finding that common agenda. So what do we want to help achieve? What is that continuity of care? What are the quality initiatives? How to resource your content expertise. You've heard 2 examples of regional breastfeeding liaisons, bridging that content expertise to WIC. But even if you don't have a regional liaison in your area, WIC is a content expert. Your clinics have content experts, and California WIC Association, many others. And then, of course, there's been many, many different studies on how change happens in clinics, organizations, hospitals, you name it. You have to identify your champions that are there. But the other initiative that works, and that's what I want to kind of mention today, is a strategic work group. So having, whether it's within your organization, a group that gets together to kind of see this initiative change happen, connecting with others outside, and as Laurel mentioned, having some sort of regular meeting, some sort of structure to that, those quality care initiatives and collaboratives that really help align those efforts. So there already existed in Alameda County a strategic work group bringing these key elements into relationship, and that was our county CPSP roundtable, the Comprehensive Perinatal Services Program, of which, as I mentioned before, with all those different community healthcare centers, we had many across the county. CPSP provides a wide range of culturally competent services to Medi-Cal pregnant women from conception through 60 days postpartum. And in addition to the standard obstetric services, the women also receive enhanced services in the areas of nutrition, psychosocial, and health education. It's a very robust program. In Alameda County, our Family Health Services Division provides a structure of support for the CPSP programs through a perinatal services coordinator, Teresa McCluskey, who facilitates quarterly roundtable meetings that offer all the clinics trainings and guidance for the requirements of the program. And Teresa and I have aligned our efforts to support breastfeeding quality care and referral to WIC and other programs for maternal child health for many years. She's got wonderful experience and relationships with the clinic perinatal coordinators, and I'm offering my technical support and liaison connections and resources to her roundtable forums and other joint ventures which benefit then the entire region. So we're able to support many clinics in many different stages of development. In this particular training that you see here, we focused on prenatal education guidelines, including the key messages and culturally and linguistically appropriate resources for patient and staff education, including, of course, WIC. We also co-promoted the development of postpartum support groups and clinic environment changes. Our Medi-Cal managed care plan also at this training gave a presentation on how coordination can help improve postpartum HEDIS measures. Just as a follow-up since this meeting in March, I've been able to meet with at least 5 of the community healthcare centers and do on-site technical support and provider trainings, leadership meetings, and then Teresa's team and I hosted a free education forum with a networking lunch and a resource fair for new staff training and promoting community resources for referrals, so people had an awareness of that. And we're even working together towards training coming up in the fall on, you know, what makes a successful group? How do you really engage mothers in groups and great things like that? So wonderful collaboration there. The core content is there in the CPSP. If you're on this call and you've got a CPSP program, or not, if you're not familiar with CPSP, it's really a fantastic program which has a structure already there within the steps to take for assessment and education, counseling strategies, individualized care planning. It's really a great starting place for all of our community healthcare centers working on the 9 steps. The billing for services, you know, is part of where, especially with the FQHC, as you heard Laurel and Leslie mention, you know, it can be very lucrative. All the CPSP programs refer to WIC, all throughout the prenatal care and postpartum. So partnering in client and staff education makes sense in ensuring that we have consistent messages and cost-effective, you know, continuous quality improvement. That's that CQI everybody talks about, but we get to work together in making that happen. And so the exciting thing is, though, is that it's already there. We're promoting the same basic education that you're going to see that you may already be working on within the 9 steps. WIC covers it and CPSP covers these basic guidelines. Primarily, to start, the differences between breastfeeding and human milk and artificial formula. You know, they're not equivocable, and it's important for mothers to have that information and know that. What are the health and developmental benefits of breastfeeding and human milk for both mom and baby? Another important thing for all mothers to understand: how does this influence her choices? What might motivate her based on her health history and her desires and hopes for her children? What are the benefits of early skin-to-skin contact and rooming in? So preparing them for the hospital experience, preparing them for the things that will help establish and create the milk production from the very get-go and help stabilize the baby, prevent you know, supplementation for hypoglycemia and all different things. So benefits of skin-to-skin. You know, we talk about the risk of formula supplementation while breastfeeding, especially in the context of protecting the mother's milk supply. So this is something that it's there in the content, and as we all say these things together, we start to see that aha moment where moms say, oh, I want a choice for however long I'm going to breastfeed. I need to have a milk supply in order to make that choice. So this is why they're guiding me in, you know, not having pacifiers and what are the risks of supplementing in those first few months. You know, documentation in the medical record of the educational encounters, the materials given. You know, there's a lot of data and reporting requirements. It's true, CPSP has a structure that helps them kind of meter out some of this, which helps with the billing. But that's one of the core content that we have within the 9 steps to track what education did every mom receive. And then the assessment and assistance with the planning and management of successful breastfeeding. So So there's that anticipatory guidance that's very patient-centered and individualized that carries itself from the prenatal education and then can bridge to the postpartum. A source that I really like to share, because we really want to share as many resources that are free and accessible and available to you today, but it's good for patient education and staff education, is the Global Health Media Project videos. They're excellent. There's, like I said, for patient and for staff education. They're multicultural videos that are evidence-based and easy to understand with really quality content. The imagery and animations, and they're available in over a dozen languages for mothers. There's provider education pieces that are brief. They're tailored for self-paced training for staff at all professional levels, nurses, doctors, midwives, health workers, and that really helps with the increase of confidence in assessment of the breastfeeding diet. So where are all the community healthcare centers of Alameda County? They are in different stages of the journey. We look at what are those scalable, achievable, aligned opportunities when we're doing quality improvement. And that really differs for every clinic, but they do share some things in common. Just as was recommended by the California Primary Care Association, who is partnering with California WIC and CDPH on helping create the support for clinics. They said, starting with steps 5, 6, and 7, right in the core, right in the center, upgrading clinic environments and patient education, and then continuing to strengthen relationships with community resources, especially WIC, and managed care plans. And for us, Alameda Alliance is a great partner. And we collaborate strategically to expand access to breastfeeding groups with lactation professionals. So that seems to be going very well for us in the patient education and community resources and environment. In different stages of progress, and I kind of, mixed it up between the green and the blue there, are the clinical services. And that kind of arises, and the progress for that arises with the level of staff education and your ability to track through electronic records. 2 of our clinics are leading the way, establishing infant feeding clinics. You heard Laurel mention about how changing the timing of the encounters can help establish those things. Scheduling, all of those things that help with the infant feeding clinics to strategically align the pediatric and prenatal care that optimize the coordination and billing. For staff education, we try to offer a real array of training options. So like you saw before, we do these group trainings. We'll always invite our community partners to our WIC trainings. We look at the online options, like California WIC Association is always having little one-pagers. So lots of different options, but how do we keep that going? That's an ongoing investment for sure. This fall, we're initiating a county-wide focus on workplace lactation accommodation together with our Alameda County Breastfeeding Coalition. So we are leveraging those networks and roundtables with all the clinics because it's really a value of Alameda County Public Health and all of its programs that their workforce and all their families have access to appropriate accommodation for breastfeeding with all of their transitions. One of the challenges for the clinics, obviously, and you saw even with the example given earlier, that ongoing quality improvement, the financial sustainability comes with the tracking, of course. There's some, right now there's a state committee that's working on a draft policy. I think it's about to be released. So just being able to give, as we develop even across different systems, some support for that, I think that'll help us along our way. I did want to go back to, that's us, but the California WIC Association and the website is there, and I think maybe Margaret might talk about it. There's right behind each of these little buttons, if you will, is a click on, it's kind of a living document. What are some of the resources that have come together from the initial creation of the 9 steps and that are ongoing as more and more clinics share their resources together about, well, here's our training module, or here's what we did, here's our sample policy. So the resources are there for you if you're just starting on this. Take it a step at a time, as they say, but go on and look at some of these websites to help guide you in your thoughts of how you're going to align with implementation towards these. And I think with that, Margaret, I'm going to pass it back to you.
Thank you so much, Jean. It was really great to hear how you really are leveraging so many different resources within one county. And yeah, just inspiring to see how it's coming together, even though it's, of course, as you say, keeping it real. We all know it takes time and it works differently in different locations. But if everybody is, walking the talk and talking the same talk, and like you said, many different programs use the same patient education, and they can build on that and each other's strengths. So thank you for sharing that. And thank you again, Leslie and Laurel, for giving us a glimpse of what it's like in one clinic. So I think those were really complimentary. Jean's slide is still showing their contact information. These are great resources for you. Other resources that we will post or link to on our website on the webinar webpage will show you the toolkit, as Jean mentioned. It is a living document, and we are open to including resources that you have. I'll just let you know that the California Breastfeeding Coalition and several RBLs just drafted and put together a sample policy. And one other thing, I'm not remembering exactly what it is right now, but they're both under step 1, policy and protocol, and that's just been updated. So that's exciting that this online toolkit is growing, and we are very open to your contributions to that. We will also post the recording for this webinar and slides and the link to the global health videos that you mentioned, Jean. That's a great resource. So right now we welcome your questions. Please type them in the question box so that we can pass them on to the presenters and get a bit of discussion going, because we've got 5 or 10 minutes for that right now. We welcome that. I was wondering, Jean, if you could go back, or I can go back to Laurel and Leslie's screen, but there was an earlier slide about some of the benefits of implementing the 9 steps and in collaborating with WIC. It was an early one with several blocks. Yeah, that one. If you could put that up again and show that on the slideshow. I was wondering, Laurel and Leslie, if you could say a little bit more about those. Maybe elaborate on, why do patients love it? What have you seen in terms of employee satisfaction and that kind of thing?
So, I think more than anything, it's especially following some of the steps that we discussed today with, the environment, being a welcoming environment for moms. I think just from the time they come into our facility, it feels like home almost to them. Our patients, the culture population that we serve, a lot of times don't realize that we offer a wealth of services, and oftentimes they have the mentality or the mindset of, oh, I've nursed before, I'm perfectly fine. And so when we're able to just do a feeding assessment recommended by the provider, patients do leave very satisfied. They come back, they thank you, they recognize your face. I actually do have a couple patients that I ran into where I live, and they, the first thing they say to me is, oh, you were that person who helped me when my baby was first born with breastfeeding, and I hadn't seen her in maybe 4 or 5 years. And so I think just having the services available to them is something that really benefits them. They feel supported. They feel that somebody's there for them. And they do leave very satisfied just by us being able to help them, whether it's a quick visit or a lengthy one.
Great.
I would add to that too, Margaret, that it's really exciting to see clinics I want to more than evolve. It's sort of like re-identify themselves, and for the patients to re-identify them. Community health centers are, kind of growing in what they're expanding and extending to the community in many situations. And when you see moms come in strollers in a neighborhood where, you have, projects across the street and not a whole lot of, just a family vibe in some places, like a little bit busier, and you start to feel like they're creating an oasis for moms to come and families to come. And then the staff gets excited, like, yeah, we support breastfeeding. And even if not everybody on the staff is, jazzed up about breastfeeding as others, just being part of a community that is offering itself to the community in a different way has been, I think, the most transformational piece of it. And then to have it actually translate into a greater awareness through the mothers and their families of what else is available in the clinic, it's a great kind of expansion again of sort of owning that's their community clinic. And what other services do I have here? Oh, I could also go to dental. Oh, I can also go here. Like the co-location of WIC is often a great asset. And not everybody has that, but they have other services at the clinic that they want to promote. And so having that connection, that continued connection, not just about you've had your baby, bye-bye, see you someday, continuing on, transforms that. And then just a sense of pride, I think, that the staff, when you see those big aha moments when they're like, oh, that's why, or oh, I get it with the staff education, then their confidence increases and they feel ready to talk to a mom. And so you can't tell, I get excited to see the transformation in this process with clinic.
That is exciting. Thank you, Jean. Anything you want to add to that, Leslie or Laurel?
No, she said it very well.
Yes. So I don't see any questions from our participants, which is a little surprising, but maybe that's just a sign that our presenters really gave a wonderful, complete overview, and they are excited to go find the resources and see what they can do in their own clinics. A couple more minutes. If anybody has a question, go ahead and type it in. In the meantime, Jean or Leslie or Laurel, if there's anything you want to add in terms of advice or pearls of wisdom or anything.
Pearls of wisdom. Well, I think something that people think that you can just jump right into the 9 steps and get it all done in 6 months. And that really doesn't happen. In our experience, it does take several years to really dive in and make sure that you look at all the steps and get that in place, and a lot of monitoring after that. It isn't just you do it once and you don't revisit. So it's sort of like maintenance on your car, getting the oil changed and checking the air pressure and the tires, and you just have to go back and recheck all those steps as time goes on. So be patient.
Good advice. And yeah, you really go ahead.
Go ahead.
I was just going to say, it's clear to me that you want to get people on board, and it's about relationships, and that does take time. So I'm glad you made that point. What else, Jean?
I was going to say that I see a lot of clinics looking at community health workers in a different way. You see that there's a lot of them are mothers themselves who have breastfed or have had challenges accessing care. And, you look at the story, even of Leslie, like, taking that to the level of a clinical professional manager. There's within your staff are the tools that you need to develop. And it's great to resource out and align with WIC and your managed care plans for, at a higher level, if you don't have that higher level of clinical services, but look within, because it's all right there. And look at some of the great free, accessible, or start with a small budget on getting some training going, but they're really capable of doing a lot within the encounters that they have with patients.
Great, thank you. All right, our time is up. I don't see any other questions. So thank you, everybody, for joining us. Thanks to our presenters for their expertise and energy and enthusiasm. And we look forward to sharing the recording with you. Don't forget to take the evaluation that will come in your follow-up email tomorrow. And hopefully you can join us for future webinars. Thanks, everyone.
Thanks, Margaret. Thanks, Karen.
Thank you, Margaret. Thank you, Jean.
Bye-bye.
Bye.
Bye.